If you do the same motions day after day, your job could be putting your spine at serious risk. Welcome to the channel. Here we share what it's like living with spinal stenosis. Let's talk about the diagnosis, focusing on everyday life challenges and ways to thrive whether you have spinal stenosis or not. Have you ever ended a workday with that familiar nagging ache in your lower back and chalked it up to just getting older? What if I told you that your job, yes, the very thing you do every day to support your life, might be setting you up for something more serious? Spinal stenosis. Spinal stenosis happens when the spaces within your spine narrow, putting pressure on the spinal cord and nerves. This can lead to pain, numbness, tingling, and even weakness in the arms or legs. It's most common in the lower back and neck. So, how does your job contribute? It comes down to micro trauma, tiny repeated stresses over time. These might not hurt at first, but over months and years, they cause inflammation, disc degeneration, bone spur formation, and joint thickening, all of which can narrow the spinal canal. Let's look at how this breaks down by movement. Frequent lifting and bending puts excessive strain on spinal disc and ligaments. Repetitive twisting can wear down the facet joints and destabilize the spine. Long periods of sitting or standing in poor posture compress the lumbar spine. Overhead work stresses the cervical spine. There are some jobs that studies and experts say are more likely to contribute to spinal stenosis. 1. Construction workers. Frequent heavy lifting, use of vibrating tools, and awkward postures. 2. Nurses and healthcare workers. Lifting patients, long shifts, bending over beds. 3. Warehouse and factory workers. Repetitive motions, long hours on hard surfaces. 4. Dentists and surgeons. Prolonged static postures, neck flexion. 5. Drivers of trucks and buses. Sitting for hours in a vibrating seat, limited movement. 6. Office workers. Sedentary lifestyle, poor ergonomic setups, neck strain. 7. Hairdressers and cashiers. Prolonged standing, awkward reaching and twisting. Even athletes, especially gymnasts, football players, and weightlifters, can develop spinal stenosis due to repetitive high impact stress. These occupational hazards, if not addressed early, can cause chronic back pain and potentially disabling spinal conditions later in life.